All right, welcome to the next episode of The Nurse and the Naturopath. Uh,
It's
yeah,
called A Nap with God and the emotional, spiritual part of healing from fibroids or from healing in general.
oops, I was out of the frame of the video. So we talked on the last episode about my nap with God. Should I summarize that again, maybe?
Yeah, I think it'd be good if you
Yeah,
talked
I was
about your nap with God and also like when it happened in your fibroid journey.
I was in a lot of pain from fibroids. I was kind of like, I don't really pray, but I guess something akin to praying, where I was just like desperately laying in bed, like, oh my God, I can't do this anymore. And I fell asleep and took this really trippy nap. I don't take drugs or psychedelics or anything because I'm super sensitive, but sometimes like just a little bit of meditation or not even will like send me into some kind of trippy state. So I went to sleep. I felt like I went somewhere else, like a deep, like trance like state, not a normal nap. When I woke up, the first words that I heard in my mind were, "You need to change everything about your life." Um, so that was really interesting. Um, and that was during a period of time where I was having a lot of just like spiritual experiences, I would call them, alongside physical pain, which I had never experienced physical pain before. And I was having in this like healing journey to in my quest to resolve the pain, had a lot of spiritual stuff come up. Like it had past life, or I know some people call them more like an alternate timeline, but I had memories of a past life come up, and like being stabbed by a sword in my abdomen, and kind of just, I don't know, I perceived it as like that energy just wanting me to recognize it so I could kind of integrate it, and understand that some of the pain wasn't about this timeline. um, and yeah, I had a lot of other really trippy spiritual experiences during about a year's time. Um, it was really intense, and I didn't like it. Like I didn't want to be having those experiences. I didn't ask for it. I didn't go do ayahuasca. Like I didn't even meditate for more than like a couple minutes here and there. Like I really was not into it. Like it's just something that was happening. Like for me, it just came with the pain. It came with the process of being curious to invite that space, like we mentioned in a different episode, into my life and give my nervous system that space to heal and unwind. And it's like, be careful what you wish for because it's going to be really cool, and it's not all going to be easy, I don't think.
When did you give your nervous system like permission? Like when was it that you said, "Okay, show me," or
I would say like through the process of receiving craniosacral therapy.
I see.
I think that was my step into. I mean, I had done some energy work stuff and nervous system stuff before then. Um, that was more like very specific on like doing tapping and therapeutic type stuff for childhood trauma. Working through some depression stuff. I had done that kind of thing, but I feel like the craniosacral therapy was really the beginning of me being like, I want to heal my nervous system. I want to give myself space and time to just unwind. And for me, part of the unwinding was an experience of physical pain and lots of spiritual sort of downloads. And it's interesting because it's something I'm really ready to talk about now, and I think is like really important because a lot of people have these experiences and there's no one to talk about it with in our culture. Um, and then a lot of people are frustrated because they're having physical pain or physical illness that doesn't make sense because it has this huge energetic, emotional, spiritual component. And no one is there to tell you that, not even necessarily your naturopath or, even people in the holistic world. Um, and I had a lot of hesitance like for a long time. Like I've thought a lot about whether I want to talk about this or not. um, because I guess I feel like there's a fear of judgment, or there was until when I decided I didn't care anymore, recently. But yeah, like I think there's some fear of of that because it can sort of get into like mental health territory, you know? Like if you're having trippy experiences, are you crazy, you know? And is that something that you want to be perceived as, like as a healer, as a doctor? But I actually don't give a shit anymore. And I think it's just way more important that people know that, you know, doctors and nurses and healers are people too, and we're allowed to exist and have, you know, we're not like this shiny, perfect whatever who never has any challenges, you know? Like, that's a stupid idea that I think needs to be done away with, you know? Like, let's take down what is it called? The Wizard of Oz curtain or whatever, you know? Like, you are not separate from these people, right? That you're coming to for healing and help. Like,
even a lot of the people that are in need of healing, like let's say white America.
Mm-hmm.
A lot of white America is not receiving education about how a lot of other cultures perceive certain types of illness, even mental illness,
right? And
or
then there's
spiritual
that,
crisis and things like that.
Yeah, we're really lacking that.
And so if you don't know, then if something happens to you like that, then you do keep it inside because you do think, oh, that's
there's
crazy.
Cultural shame. Yeah,
cultural shame,
and I want to
so much
help do away with that.
I think because I did grow up like that in very Christian right-wing society.
Yeah.
Nursing school is actually super helpful for me in that way because we had multiple courses and some pretty in-depth about culture,
like cultural sensitivity trainings, and really understanding different cultures' approaches to medicine.
Exactly. Yeah. And it was very in-depth. Yeah. And it was taken very seriously. It wasn't like this is a little segment of a course. These were big courses that really had you go in deep and see it in a totally different way. Yeah. And it validated so much that it was okay and normal even to have these like spiritual crises.
Right. As part of a
medical injury, trauma, or even just in response, not just even like a physical trauma, but seeing trauma or having something can have physical symptoms, can cause a spiritual crisis, and seeing how different really cultures, especially older cultures than ours, because that gives me more credence to it, maybe because they've just been doing it for so much longer. Like, if they've come to this conclusion and this is how they do it, and it's all, who are we to say? Yeah. And to have it be taken with such reverence and very like, this is absolutely valid. This is really just, especially at that time in my life when I was very much into science. Yeah. Let me take that as I have to consider this. Yeah.
And those were classes in your nursing school education. Yes. Yeah, that's really cool. I feel like you got more of that than I even did in naturopathic school. There was not a single time. I don't mean to talk a ton of shit about naturopathic school. Like, I know I'm kind of doing that, you know, and I'm super grateful for my education. And I actually complain a lot less about it than a lot of my peers overall. But yeah, I mean, that was, I don't ever remember talking about that, you know, ever. Again, outside of maybe a little bit in homeopathy. No, not really, though. Not the spiritual. Like, that was not a part of things. Spiritual or energetic stuff, you know. The spiritual part was not a part of things. I do remember taking medical anthropology in undergrad, and that was a really cool class that I loved because it's everything that you're talking about. Like, it's a whole field of study devoted to different cultural practices around health and healing, and like different how these philosophies shape our medicine in ways we don't even think about. Like, one thing that always stood out to me was we read this book. I can't remember the name of it, but it was this book about, you know, this real life story about a child having epilepsy.
Oh, we read that book too.
Yeah. Mm-hmm. That's like the curriculum the book to teach you about that.
Yeah. Do you remember what it was called? Were Hmong too.
Yeah.
It was a Hmong family.
Do you remember the name of it?
Gosh, I don't remember the name. I don't know. That was one of the books that we read.
And of course, you know, for them, it was like a soul loss thing, right? And like, that's a thing in a lot of cultures too, this idea that, you know, the shaman will help you when you're sick because they understand that part of you is missing or is lost or is wanting integration when you're not physically well or mentally. For other cultures, there's not quite that separation as much or at all, potentially. And yeah, that book was all about that kind of relationship between and dichotomy of the doctors in the hospital and this Hmong family, approaching epilepsy and how they, but I don't know. I feel like even within that context, it's all very like, well, here's how you be respectful and here's how you kind of work with it without totally poo-pooing their whole thing, but it's still not like, how do we support people through the process of spiritual healing and how do we understand the energetics of the body,
Right. I just think
it's a good start, though.
It's a good start. And I also think from a medical model, if you are dealing with people who are going to be medical professionals working in a hospital.
Totally important.
It's also not totally your job.
True. That's true,
to do that. It's more just realize that this is 100% valid. Everything that they're doing is valid, and we're going to do everything we can to support it. But I'm not the facilitator of it.
It could be your job if the whole model were different.
Well, that's true.
Of hospitals and healing and health.
And that's part of one of the things in our classes that we did was actually to see our system as how weird and flawed it actually is.
It's not a hierarchy of like, anyway, go on. Yeah, this is
that was really helpful because we did they would do these like trick things to us in our class where we would read these short stories about this culture and initially you'd be like, this is so fucked up. Like where is who would do this?
Yeah.
And then it was actually about us.
Right. Do you remember any of those stories?
Yeah, some of it was like weird little things. I don't remember the whole stories, but I remember little parts of it where it'd be like, they poop in their most precious resource. And, and like,
we do
and
that.
we do, right?
Yeah.
And like, just like little things like that. And you'd be like, these people are absolutely nuts. Who would do this? It's so stupid. It's against their best interest and all this stuff. And then at the end, when it was presented to you, it'd be like, it was like all things that we absolutely do. And one of them was about the hospitals, about how like, everyone goes into this building when they're sick, even though they know that there's this % chance they're going to die there. And like,
that
all this stuff, right?
Surrounded by germs and caught in this poorly ventilated
who would do
area.
This? And this is ridiculous. And like, we had read all these things, and then it was like, then we found out how it was that was actually our American culture.
And
Western
that's
culture.
Anthropology. Like, that's medical anthropology, which I did my undergrad in anthropology, which is like cultural studies. And yeah, it's really cool when you start to realize like, we have a natural bias of like, ours is the best, everyone does. And in reality, you're all just coming at it from your own cultural bias and understanding that you've been raised with. And I remember one of the things in the medical anthropology class at Smith was like, like this metaphor of war, seeing cancer or an illness as an invader, we're going to kill this, we're going to, here's how we're going to kill the cancer, all this terminology, that is they're all from war. They're all wartime words that we use. And we use a lot of wartime words in medicine, in Western medicine, that kind of paint illness in the body as something separate from you, always. Not a part of you, and like an invader and an attacker. And so a lot of the terms in conventional medicine and around surgery and cancer treatments, and just there's a lot that has to do with wartime, eradication, just all the things. So it's, even we're gonna fight, cancer. It just, there's nothing wrong with that. I'm just pointing out that there's a specific terminology to our culture that isn't necessarily the same in every culture, and it comes from this thing that we don't often even think about or have our awareness on, this model for the body as separate from things that cause illness, and this just wartime metaphor was one of the things that really stood out to me in that class and helped me, start to think about how our culture views healing in the body too. What have some of your experience has been, or what some of your knowledge around spiritual elements of healing, of physical healing.
I don't know. I sometimes don't exactly know what spiritual means.
Yeah.
That's always like a word for me that used to be a big trigger because I would associate it with religion. And now for me, I don't feel like it's associated with religion anymore, but it still is for a lot of people.
Yeah.
And so sometimes I don't know how to like fit things into that category.
If I use the word consciousness, does that change it?
Yeah.
Okay. Words matter sometimes. So what are your experiences or knowledge to share around like physical healing and consciousness?
Yeah, I have done a lot of work with like meditation.
Yeah.
And attuning my consciousness and working on what am I.
Yeah.
And then using some strategies to help with chronic pain.
Yeah.
It started off with kind of like, talking to yourself and, you saying good things to yourself and that kind of thing. And the affirmations and the whole Louise Hay and, your body's listening to you. And so
I have her book right here.
In
case we wanted to talk about her book.
We can look up what fibroids are.
Okay. Yeah, you keep talking while I do that.
So it started with Louise Hay and like having the affirmations and for whatever things I was working with, headaches or hip pain or anything, and using the affirmations to put that into my conscious and subconscious.
And really quick, whoever doesn't know who Louise Hay is, go look it up because she's amazing. But she kind of like brought, I would say, affirmations to like pop culture. Or
I think so.
I would say, and she died just a couple years ago, right? Yes. She was like 80 something.
Mm-hmm.
She lived in San Diego, I think. She was amazing. And she was like a super, like, had a crazy traumatic abusive childhood, sexual abuse survivor, and wrote this really great book where you can look up conditions and what she feels was the like energetic association
pattern that caused it.
So carry on.
And then an affirmation that you can say to help replace that thought pattern with a thought pattern that helps those cells of your body to move in a different way.
Yeah.
So, and then I played with a lot of different things, frequency of my consciousness to like, can I vibrate at the frequency of oxytocin and love my pain, which does help.
Yeah.
Can I push my consciousness into the pain and become the consciousness of the pain?
Yeah.
And that is when I'm maybe still having the pain, but I'm not having the experience of the pain.
Yeah.
And
that's really cool.
It does, all those things do really help.
Yeah.
And work in my experience.
Kind of related but unrelated, but when you worked in the hospital for how many years?
4.5 years.
Because now, and then for how long have you been doing triage nursing on the phone?
10
years. When you were in the hospital, did you, I'm assuming you had patients with like psychosis that would come in, and was there ever anything that came up with that around like, something spiritual or consciousness based, or did you ever think about that?
I absolutely thought about it. And then I've also thought about it since then when I've delved deeper into my meditation and things like that.
Yeah.
But I did know from some of the cultural studies that we did that things like schizophrenia, and different types of psychiatric disorders that we call here are seen as something totally different in other cultures. So I already had that in my my mind.
Yeah.
And the more that I meditated and saw the reality of it, then it became more obvious to me. Personally, I think you can see other timelines simultaneously, and that's
just a little too much at
once. And it's really scary, and there's not a place to especially in Western culture, for how to help integrate that.
Right.
And so to try to make it go away, the medications don't make them feel like themselves.
Yeah.
I'm not saying that medication isn't necessary. I believe it's actually really necessary for a lot of people so that you can have that. But just validating them that they're not crazy. They're just having more experience than the average person, because that's how they were wired to have this experience. Instead of like there's something wrong with you.
Right.
You're actually seeing more.
Yeah, your energy's almost porous more, or your intuition channels are on high.
Right.
Yeah.
And just to know that other cultures already established that.
Right.
Made it so much easier for me to be able to like feel that for patients. And it's so interesting too, because there is some common threads sometimes between a lot of schizophrenic people.
Like what?
Like a lot of people feel like there's implants in their body, or that they're being controlled from somewhere else.
Yeah.
And things like that.
Interesting.
And it is really interesting because those common threads, I feel like, do mean something,
what do they mean?
I don't know, but I feel like there's this, I honestly think that a lot of the whole control thing comes because they feel like they're out of control all the time. And so their brain's trying to make sense of the fact that they feel out of control. So then they have to think that they're being controlled by something else, because otherwise it's even too much to handle then that they don't have any control.
Yeah. Yeah.
So I think that's something that the mind comes up with to try to explain why they're feeling
what about
this
like
way.
The implant thing? Do you have any like insights into that part?
Part of me thinks sometimes, because I don't know, I would love to know too if that's common outside of the USA. Because part of me thinks it's because we have it so ingrained that there's stuff wrong with us. But I think people in general do. Like, even you don't have schizophrenia, you don't have whatever, you're perfectly healthy, whatever that means.
Yeah.
We are always constantly being told there's something wrong with us. And in religion too, but you have to be saved, right? Because we're inherently bad.
Right. You're a sinner. Right. Yeah. There's something inside you, you just existing as you, that's bad.
Yes. We all have that in us.
Deep real
so
quick.
Strong.
No, that's a really interesting idea about that potentially being correlated to this idea of like someone put something in me and it's bad. And
right.
Yeah. I wonder if in other cultures it's as common. That would be a really interesting study that no one will ever fund. But it sounds really cool. Do people who have a schizophrenia diagnosis in the U.S. versus other countries,
especially in other country that doesn't have as much shame? But see, the problem is humans, most cultures have some kind of shame. So you have to find a culture where they really don't.
Whatever cultures where they have the least shame, do they report the same amount of schizophrenics reporting fears about implants inside of them? Let's do that study. Anybody? Anybody want to fund that? Also, in case anyone's wondering, the spiritual meaning, according to Louise Hay, of fibroids are nursing a hurt from a partner or a blow to the feminine ego. And the affirmation is, I release the pattern in me that attracted this experience. I create only good in my life. That's one of her more generic affirmations, but that's okay. Still love you, Louise Hay.
Louise Hay is a good starting point. She's not the end point of a healing journey. Yeah. She's the starting point for a healing journey.
To me, one of the really cool things about her is she's one of those people who went through a bunch of shit, was really physically sick, mentally unwell, super traumatized, abused, like I said, sexual abuse survivor, all the things, and then thrived. And anytime someone does that, I want to know what they did, just to see, okay, that's a way this can go. I think that's really important information,
Oh, 100%.
Yeah, you do that from working with your consciousness, your spirituality, whatever you want to call it, I think is always telling. Like, that's important information.
And because she found this, right? She found this and shared it with the world.
Yeah.
So many other people not only healed from their trauma, physical, mental, emotional.
Yeah.
But because they were able to get it sooner.
Yeah.
They could take it even further. That's why I say it's a starting point.
Yeah.
Because it has grown so much since then. That does not take anything like an OG, away
old school.
From what you can learn in there. Totally. It just means that you can go past there now.
Yeah. Yeah. Yeah, and like for me, often I do still use her book.
Me too.
You know, and I'll find it helpful. Like if a client has, I don't know, they hurt their ankle, I'm looking up what did Louise Hay say about ankles and seeing if that resonates for that person and if intuitively that resonates for me for them. And sometimes, a lot of the times, it does.
Oh my gosh, it totally does.
I don't know how she did it, but but then like the fibroid one, I think for me wasn't quite right on the money. Like maybe nursing old wounds when we're from parents. I don't really care about romantic partners, so for me, like that one doesn't fit at all. I don't think I'm sitting around nursing some romantic.
I don't think so either. I think it was more parents.
Yeah, but but it's interesting and helpful, and I mean, honestly, anyone here. I have this other book. Anyone who like during a time where I was going through these spiritual healing experiences, I would also like to point out, like, my aunt is an acupuncturist. I'm surrounded by plenty of, hippies. I didn't know you really at that time, I don't think. Did I? So that was unfortunate for me. But I really didn't have people in my life who could guide me in any way, like, about the spiritual element of healing. I feel like I tried to ask my hippie elders. I know I did. Like, oh, did you guys ever have any, like, spiritual experiences when you were doing physical healing and stuff? Like, I know you guys did a lot of psychedelics and things like that. Or, I'd ask them, like, when you felt really ungrounded after meditation, like, or a psychedelic, what would you do? And they're like, oh, we don't remember ever having that. So I was like, okay, well, this has been really helpful. Thanks, guys. So I didn't have any, I don't know, maybe they just don't remember because they did so many psychedelics. I'm not sure. Or maybe they were just tripping balls so much that they didn't care. Like, I felt like I had so many experiences of spiritual stuff coming up without any support, context, guidance, other than, like, one energy healer who was great. So any book or person who could kind of validate for me, hey, sometimes physical healing has, like, a spiritual component was really helpful. And I have this book that I got, and it's called The End of Your World. And it made me laugh because it's so dramatic.
Positive.
It's but honestly, it was validating. At the time, I was like, yeah, this is a whole, like, my ego is kind of dying, something's happening. And it feels like that to me, that's what it felt like. Just for, like, yeah, a little over a year, maybe a year and a half. But definitely the better part of at least a year, I had lots and lots of intense spiritual experiences that just kept coming and kept coming. And then it, like, quieted down and things, like, integrated. Like, it was like, okay, you're good for now. Go integrate this stuff. But during that year, it was like, I just had no choice. I was like, just getting hit with a steamroller. Like, I don't know. It's fun and it's interesting, but it's confusing.
Can you give an example of, like, experience you got hit with this spiritual?
Like I said, like, one day, I just went to the beach to meditate. Again, I'm in a lot of physical pain during this whole thing, so lots of physical pain happening. Went to the beach to meditate one day and just kind of try to connect to the pain, and had, these visions of myself in another life as a knight, like knight on a white horse kind of thing, whatever, having these sword fights, and saw myself, like, getting stabbed in the abdomen. And for me, the takeaway was just like, this pain is bigger than just this timeline. And, this is one thing that for whatever reason needed to be shared with me. Maybe not for a reason, but maybe just so I could understand that that's a thing that can happen to people, where they're experiencing physical issues that have more to do with other timelines than this one, or at least have layers of that. Because I do think that's kind of what I took from that personally, so that I could help other people in that way too. Things like that, but it's like when you're just trying to, meanwhile, like, I'm trying to go to, finish ND school, and I'm trying to go to clinic and show up and be a student doctor and, like, prove that I'm, like, ready to, be that. And I'm, like, working with doula clients and having meetings, and it's really hard. I found it very hard to show up in the way that I felt I was expected to while I'm having all these trippy experiences, Like, it felt like really like taking psychedelics and then trying to go, like, do a work task,
Yeah.
Except that I didn't take any, so that was very frustrating to me. So it was just hard. It was hard not having the cultural support and guidance. of, that this could be normal, and hard. Yeah, I guess that's really what it comes down to when I think about it. That's all of it. Because if it had been okay to talk about, and I think I faked it pretty well. I don't think anyone ever, I would ask my friends sometimes, and I don't think anyone ever actually knew that I was spiritually tripping balls, even in clinic, somehow I could just fake it. It just, I felt really weird inside because of all these shifts that were happening. And I was feeling really out of body a lot of the time. And it felt scary, for me. Again, just because we don't have that framework.
I know. I mean, I never had the framework either, I think this is something, I don't know if it's new, but was new to me, and I know it's new to you.
Yeah.
And I think that is what, having some words and getting it out there for anybody who does want to know or is having the feelings is helpful, because sometimes putting the words to it validates you so much.
Oh, and then so much.
Just to have that framework, it takes this weight off, and then you can actually lean into it. Totally. Because you're okay.
Yeah, you need to have that safety and feel safe that it's okay.
Yeah, I mean, obviously you don't need to, because you didn't, and you still were able to figure it out. Would have been so you don't need to,
a lot nicer.
But a lot nicer. And I've had other mentors and people that I've met that put words to things that have really just helped shift everything.
Totally.
And one of the things is that, when you're having those feelings and to know, oh, my frequency that my atoms are vibrating at is changing.
Yeah, you don't have to label this as you're having a psychotic break or your depression or whatever. You don't have to have that.
My mind, you can label it, but that's my mind labeling it.
Right.
So my body is having the experience of vibrating at a new frequency.
Right.
Which it wanted to do.
Yeah.
Otherwise it wouldn't be doing it.
Yeah.
And then your consciousness hasn't fully caught up to it yet. So your brain tries to name it and says, we don't know what this is, but it feels really fucking scary. So it's probably a psychotic break.
Right.
Or it's probably you're dying or something wrong with you. That's why some people have panic attacks and things like that. It's because your brain is trying to name it, but your brain it needs to really be taken out of the equation, because your body feels it. Then your conscious needs to catch up to it. Yeah. And if you can keep it between those two, you're golden. But if our brain has to get into it, it'd be great if that came last. But it doesn't always. But to know that, now you can say, oh, my brain's getting involved.
Yeah.
I'm going to let it, because that's what its job is to do here.
Yeah.
But I know consciously, with my brain even, that it's just not catching up to this new frequency that I'm vibrating at.
Yeah. I think that's really helpful. And you've taught me some of that stuff too, which is also a whole other way to look at it. For me, during that time, I got really into, leaning on this idea that, okay, in other cultures, they have shamans and they have people who totally validate that you might have, imagery come to you or, different things while you're going through physical pain or going through healing. Just knowing that other cultures had, that this was normal, was helpful, even if I didn't have a lot of it around me. And I had, one or two healers and energy workers who had been through similar things who were it's normal, So I don't know what I would have done without that, because I really worried. Go ahead, were you to say something?
No, go ahead.
That I was maybe going crazy.
I was just going to say that I think most people actually get images and get messages all the time, but because we dismiss them as just things that pop into our brain.
Totally.
And so that's how we are, since we're dismissing it so much, then we get it less and less.
Right. And it's very quick. That process of dismissal can happen so quickly.
Oh, to the point we don't even remember. You don't even remember. But if you start being aware, because it would be oh, my mind made that up. Yeah, it made it up.
Yeah.
That's the subconscious or your let's get rid of the judgment.
Right.
If you close your eyes and you see, and you're seeing this color, or sometimes you see this shape, or you see this whatever, it doesn't mean you have to attach a bunch of meaning or story to it.
Right.
At all.
Right.
But if something came into your mind and you just start noticing what it is, when I was at the beach and I suddenly started thinking about cats or something. Yeah. You don't even need to go down a deep dive of anything. Yeah. You're just noticing what pops into your mind without judgment.
Yeah.
Without you having thinking about it, just things that pop in your head. That's your first step to getting in touch with your intuition.
That's true.
Because we're constantly getting those, but we're constantly dismissing them because they seem random.
Well, and that's another cultural thing that we don't have validation and support for. We're not sitting around teaching the little children, most of the time in preschool, they're not learning, how do you trust yourself? How do you listen to your body? How do you hear your intuition? We don't learn that, so we lose it.
Right.
So again, I think it's all about the cultural framework, but Yeah, I remember I had 2 like best friends, and I said to both of them, I'm not sure, and meanwhile, I'm like studying the DSM manual and everything, and going to clinic, and I'm like, look, so of course there's tons of judgment coming into my mind of like, I'm insane. That's what I'm crazy.
It says right here in this book.
So look at that. Which one is it? I wonder. Could be all of them. I don't know. But I remember saying to 2, really close like best friends, I need you guys to tell me if ever you think, okay, this seems crazy. We should go to the hospital today. I will go. You tell me, because I don't know anymore. I don't know anymore what the line is, because every day was just a new adventure. Like that sword, imagery that came from a meditation. Sometimes things came without even meditating. So every day was a new thing. Every single day was like that for a year. So I just told them, like, you have to tell me, because I don't know anymore where the line is. I don't, I mean, I can fake it and everything and pretend like I'm not having all these experiences on the inside.
And newsflash, they never wanted you to go to the hospital.
Yeah, they never wanted me to go to the hospital. And I did have an awareness of like, okay, at least I do know sort of, what's real and not real. I mean, that's a whole other story of what even is reality. But, you know what I mean? In this 3D world that we're experiencing right now, I did always know, and I always kind of told myself, and so I'm grateful. As long as I know what's like imagery, or a trippy out of body feeling, and what's actually here in the 3D, I'm okay. I'm probably okay.
For sure.
Once I'm not sure, like then that, what's quote unquote real and not real, then that would be scarier. Maybe that was my own line I set for myself. Yeah. That never happened. So I was like, okay. But it was just a really trippy time. And a lot of good came out of it, and a lot of healing, and a vast ability to like understand naturopathic work and healing, and like working with my clients in a whole new way too. So I'm really grateful.
Absolutely.
It was just really hard and scary at the time.
Yeah.
And that's all for today.
Thanks for listening to The Nurse and the Naturopath. Please subscribe and follow.